Okay. Like Prof is looking very professional there. We can't hear you.
Okay, so can you hear me now?
Yes. It's not that sharp, but we can hear you.
I'll move the headphones.
Let's see if we can hear you better live, natural. Ebosaram, we can't see your whole face. So you need to alter your camera. We can only see half of your face. Better. Good.
Hi, everyone. Good afternoon.
Good afternoon. Is that John?
Yes, this is John. Good afternoon.
Hi, John. Good afternoon.
Good afternoon, Dr. Chow. Welcome. Good afternoon, Prof.
Hi, am I more audible now?
Yes, you're much better.
You are, Prof.
Okay, I lost. Hi,
Tanya.
Hi, Tanya.
Hi, Tanya.
Hi, Tanya.
Okay, so Miss Tanya, are you going to mute everybody? You are muted.
Okay, so we start. Good afternoon, everyone. Please, can you confirm that you can hear me and see me loud and clear? Just with a thumbs up in the chat section. And as we begin to join, welcome to the World Parkinson's Day webinar at the Adewunmi Desalu Parkinson's Foundation. Today is the Global World Parkinson's Day, and it's an awareness day. So it's the 11th of April. To commemorate this day, we have organized this amazing webinar with our line of speakers. So if you're joining in now, please, I'd like everyone to just send in a chat with your name, what you do, and where you're joining in from. So what country or what state, what part of Nigeria, if you're not in Nigeria, what country are you joining in from? So I'd like to see chats and just do a brief welcome. Okay, thank you. I see your thumbs up. So please just help me send in your name, where you're joining in from, and what part of the country, if you want to tell us what you do. So we're expecting 3 categories of audiences. We're expecting healthcare professionals, we're expecting people living with Parkinson's and their caregivers, and we're expecting the general public. So thank you. Welcome, Professor Njideka. Thank you for joining. Tanya from Parkinson's Africa, thank you for joining. Laura Ede, thank you for joining. I'm expecting to see, so these are our people. And I'm expecting, Nkechi Obianoze from HOT Abuja, Hot Abuja. So sorry about that. It's hot in Lagos as well. Thank you, team. Dr. Mamodu was so happy to have you. Walter from Ghana, thank you. Clemmy, thank you so much for being a part of this. Komla from Lagos, ADPF, thank you. Mori Desalu, Mrs. D, thank you for joining in. John, we see you. Dr. Sarah Chabiri from Meduguri, Nigeria, thank you. Gerald Onwebuze, apologies for that. From Abuja, thank you for joining. So I'm wrapping this up in about 30 seconds. Mrs. Blessing, thank you for joining. Muturayo, I see you. Miss Olatunji, thank you for joining in. Team NPDR, okay. Please indicate against your name. Chinyere Chukwuka, thank you, ma'am. Richard from Ghana, thank you. So as we continue to join in, so let's just let's send in our names and where we're joining in from. We're so happy to have everyone here. We promise you to have an amazing time. You're going to have an amazing time learning, sharing, and just Understanding Parkinson's Better. The title, the theme for this webinar is Navigating Parkinson's Disease Care in Nigeria and Africa. And I believe that as we continue, we would have a great time learning. So to move further, I would like to introduce and welcome our Executive Director to just give us our opening remark. And that's in person of Laura Ede.
Hello, everyone. Thank you, Cholu. Warm greetings, everyone, and it's really nice to see everybody that has joined this webinar. I understand that it is public holiday here in Lagos, Nigeria. So it's really good to see people have taken time off to actually join us. I was so glad to see everybody has joined us across the world. So on this World Parkinson's Day, we're coming together not only to raise awareness about this progressive neurological condition, but also to focus on specific challenges and opportunities faced by those living with Parkinson's disease in Africa. The Adewunmi Desalu Parkinson's Foundation is very well honored to host this important discussion. As many of you know, Parkinson's disease affects millions of people worldwide, and Africa is no exception. However, access to proper diagnosis, treatment, and support can be significantly limited across the continent. So today, we are incredibly fortunate to have a distinguished panel of seasoned speakers who will share their expertise on navigating Parkinson's disease care within the African context. We will hear about the latest advancements in treatment, explore strategies for managing the condition, and discuss crucial role for advocacy in improving the lives of those affected by Parkinson's disease. So over the next hour, we're going to delve into crucial topics, talking about the current state of Parkinson's disease in Africa, strategies for overcoming obstacles when it comes to diagnosis and treatment, the importance of early intervention and ongoing support, and also the role of advocacy in improving access to resources and care. This particular webinar on World Parkinson's Day is an excellent opportunity to learn from each other, share experiences, and explore ways to build a more robust support system for people with Parkinson's disease in Africa. So whether you're a person living with Parkinson's disease, a caregiver, a healthcare professional, or simply someone who just wants to learn about this condition, we welcome your active participation. So please feel free to ask questions during the session. Together, through collaboration, knowledge sharing, and unwavering commitment, we can create a brighter future for those navigating Parkinson's disease care in Africa. Thank you once again for joining us. So let's get started. Happy World Parkinson's Day, everyone.
Thank you. Thank you so much for joining. Okay, so just give me a second. Okay, so we move quickly to talking about the Adewunmi Desalu Parkinson's Foundation. Sorry. Okay, so we move quickly to talking about the Adewunmi Desalu Parkinson's Foundation, what we do and how we do what we do. So the Adewunmi Desalu Parkinson's Foundation was founded in April, our vision, April 2022. Our vision is to provide care and support to people impacted by Parkinson's disease in Nigeria and all over Africa. Our mission is to provide support and advocate for people impacted by Parkinson's disease, create a strong community, and contribute towards finding a cure. We have a commitment to raise awareness in our community, provide evidence-based information, provide seamless routes to diagnosis, quality and affordable medication, rehabilitative care, and support services. Just as a background information, we all know that Parkinson's disease is a degenerative condition of the brain that is associated with motor symptoms and a range of non-motor symptoms, non-motor complication. These symptoms contribute to limitation in speech, mobility, and many areas of life. The cause of PD is unknown, and unfortunately, there are no cure yet. Our story. So for a decade, the Adewunmi Desalu Parkinson's Foundation was founded after Dr. Adewunmi Desalu, an engineer, a renowned engineer and a mathematician who fought a silent battle with PD, a journey that was marked by strength and resilience. The foundation, the family realized that they had access to a lot of care and support, and after his passing, they decided to create a legacy in honor of Dr. Adewunmi Desalu, and that's why we have ADPF today. Dr. Desalu lived 10 years post-diagnosis, but his legacy lives on through the Adewunmi Desalu Parkinson's Foundation. This center was established in his memory as a place where we provide support to individuals living with PD, extending a helping and encouragement to caregivers, and assistance to families navigating a similar path. The problem, Parkinson's is imagined as a significant and rapidly growing health concern in Nigeria, particularly among the aging population. Globally, right now, PD affects 1 to 2% of individuals over 60 years, making it the fastest growing neurological condition in the world. The urgency of the issue lies in the fact that in Nigeria, Nigeria has the largest population in Africa, with around 5.25 million people above the age of 65. So you know what that means. This put them at an increased risk of developing Parkinson's disease due to aging, despite underreporting and undiagnosis. As life expectancy increases and the population ages, the prevalence of PD is expected to rise. And this is why we're here. So it calls for an urgent intervention. The situation clearly demands prompt action to alleviate the potential cases, the potential needs within the healthcare system and society. Our objectives, we have 3 major harms, and that's to provide education by raising awareness and disseminating evidence-based information about Parkinson's. We provide care. So we offer a seamless pathway to diagnosis, consultation, medication, rehabilitation, and social support. We also provide support, which is we provide psychosocial support to individuals affected by Parkinson's disease, recognizing the importance of emotional well-being. How do we do this? Our education program, one of our program is the webinar that you're attending at this time. We have advocacy and awareness outreaches. We had a walking football last year. We've had 2 Move for PD campaign, which is the awareness walk to raise awareness for Parkinson's disease in Lagos. We have the World PD Day campaign today, and starting from last week, we've had quite a number of media rounds. If you were on radio today, you'd have heard some of us on radio just talking about Parkinson's and letting people know about the disease and the kind of support that is accessible to them. We also have an annual symposium. We had the maiden edition last year. It's a stakeholder symposium that brings together healthcare professionals, the government practitioners, people with living with Parkinson's, the caregivers, and just the general public to have a conversation about Parkinson's, the issues that people have in the country, accessing care, accessing diagnosis, and all of that. The second annual Parkinson's Disease Symposium is on the way. It's happening on the 3rd of May. You'll hear more about it at the end of this webinar. We also provide care. And our care programs we have referral for diagnosis. We have a physiotherapy program at the gym where our members, we call people living with Parkinson's our members. They come in for their physiotherapy and fitness program. We have a dance program. There's a dance coach who takes them through different kinds of dance sessions. And dance is a very, very, very good therapy for people living with Parkinson's. We have a boxing program. We call it the Rocksteady Boxing Program. It was adopted after the Rocksteady Boxing Program in the United States. We have an handwriting program. It's called the Overcoming Micrographia Program. Micrographia is a symptom of Parkinson's, which is a significant decline and decrease in the handwriting of people who live with Parkinson's. And so we have developed a program to help them improve their handwriting, either by making it more visible and making it significantly legible. We have fitness exercises, we have sip and paint, are developing programs of occupational therapy, speech therapy, LSVT loud. And, to our support at the center, one of the things that we do is to just make sure that once you walk into the foundation, the first thing you will know is that you found support. You found people who get you, who understand what you're going through. And so it's a community. It's a community that provides support. We have a program where we're looking to provide medication support to vulnerable people living with Parkinson's. Welfare support. We've had to support some of our members with, getting them, helping them to access the programs that we offer here at the center. And we usually just ask people who are interested in providing funds for that. We have a support group, and this is a big deal because it's one thing to have PD and you're in your house dealing with it by yourself. But when you come to ADPF and you sit with people who go through who are going through the same kind of things you're going through, maybe the symptoms are quite different, similar, but at different times, but they get you. And so you can share, you can ask questions, you can, we have different things that happen at our support group. It's a community, it's a training program, it's a learning time for our members, and it's just a bonding time for them. We do this in hybrid, and then we have the virtual one as well. And so we're also looking to create support group cells in Lagos, in other parts of Lagos, for people who are unable to find us in Surulere. Our impact in the last 2 years, we've reached out to over 10,000 people directly and indirectly through our educational programs. We have helped 936 individuals through our tailored Parkinson's care program. So we've had, sorry, I beg your pardon, we've had 936 care sessions so far at the center, and we have supported 56 people. So at the moment we have over 50 individuals with Parkinson's. We have close to 100 individuals with Parkinson's and their caregivers. Our membership growth has been phenomenal. We started with no member. There's nothing like this in this country. And so we started with 1, we've grown to 2, we've grown to 3, and now we're looking at about 56 individuals, about 60 individuals living with Parkinson's in Lagos. Our beneficiary story. As you look through the screen, you can just quickly glance through to see that this is one out of the many people that we have helped. And her story is quite unique because she was a nurse who lived with Parkinson's for 9 years before she got a diagnosis. Her Parkinson's was trauma-induced. Her husband passed and Parkinson's set in, and she had to stop work. She had to stop so many things. And even while she's unable to do that, she still couldn't get the help that she needed at the time. Unable to afford necessities and basic things, she relied on church contributions as she struggled to support her family. At the time when she came into ADPF, she was almost losing hope. There was no diagnosis, no medication. So you can imagine, if you're healthcare professionals here, you can imagine how bad her symptoms would have been. ADPF provided a lifeline. We restored our abilities and bringing joy through our participation in physiotherapy. The first thing we did was to refer her for diagnosis, and that's why this is the first step. Anyone who comes in here and doesn't even know what they have, you see the symptoms, whether they're visible or not, we refer them to the Lagos University Teaching Hospital, where they get a diagnosis. And after they've gotten their diagnosis and have been prescribed the medication, they now come back, which happened in our case. She came back for physiotherapy assessments. She does the dance sessions. She attends the support group activities. And now we can say that Mrs. B lives a normal life. She's not just surviving, she's happy. with the contribution of people and our funders and people who support what we do, I've been able to help Mrs. B to just provide essential care and support to our family. She's been able to provide for her family now, unlike she was able to do before. Our goal. So this year, we're increasing our numbers. We're looking to reach out to over 100 people living with Parkinson's in Lagos. We're located in Lagos, so our catchment area is Lagos, Nigeria. We're looking to increase our membership to over 100, to directly reach over 3,000 people through our training and awareness programs, and to just have over 50,000 reach through our indirect programs, maybe by the posts you see online, our media rounds, our television interviews, and just basically putting out content to educate people about Parkinson's. How can you support? You can partner with us. You can sponsor a program. You can support a person living with Parkinson's, and you can use your influence to just connect us with anyone who may be willing to help. The other part is that you can volunteer. So these are our partnerships that we've had so far in the last 2 years. We're looking to get more partners and increase our network and net worth. I would have to take a break at this point. So thank you so much for being a part of this. If you would like to learn more about ADPF, what we do, how we do it, and you just want to support, just please reach out to us, send us an email, or visit us at the center. We're open to having people visit the center and get to know more about what we do. So I will hand over to Mr. John Akinola, the Senior Programs Manager of ADPF, who would just run us through the webinar agenda and introduce our first speaker, Professor Njideka Akubadijo. Thank you.
Thank you very much, Tolu, and good afternoon, good morning, good evening, wherever you are watching us from. Today's webinar is focusing on navigating Parkinson's disease care in Africa, focusing on understanding the healthcare system and accessing PD specialists and support services. Our objectives is to educate individuals with Parkinson's in Nigeria and Africa about navigating the healthcare system, providing practical tips for accessing specialists and support services, and also equipping participants with effective communication strategies to advocate for optimal care and fostering a sense of community and support among individuals affected with Parkinson's. We are honored to have 3 esteemed guests who have a decade of experience in managing Parkinson's. The first speaker is going to be Professor Njideka Akubadijo, who will be leading the discussion on navigating PD care in Africa, addressing challenges and providing practical tips for accessing specialists and support services. The second speaker is Dr. Mamadou Cham, who will explore diagnosis barrier and effective communication strategies within the ecosystem. And of course, the last but not the least is Clemi. Clemi would be discussing advocating for optimal care on a global landscape. So today's audience includes, it has been mentioned before, we have professionals, we have caregivers, we have people living with Parkinson's, we have individuals living with across the globe, we have stakeholders across sectors and the public. So I will go straight into introducing our first guest, who is Professor Njideka Akubadijo, who is a professor of neurologist at the College of Medicine, University of Lagos, and a honorary consultant neurologist at the Lagos University Teaching Hospital. So please make welcome. She has wealth of experience of close to over 2 decades I can't even see the exact thing now, but all right. So let's make welcome our first speaker, Professor Njidika Okubadejo.
Hello, Prof. If you can hear me, okay, found you now. So sorry. Okay.
Okay, so thank you. I'm unmuted. Thank you for the kind introduction. I pre-recorded my talk because one cannot entirely rely on the internet. So I think that John is about to play the recorded session. Thank you, everyone.
Hello, Ma, can you see my screen? So your slide is up, I believe. Hello, Prof. Oh God, I can't hear you, Ma. She's unmuted, right? Yeah.
Okay, so I've unmuted. If there are any challenges, I can share slides from my end. Do you want me to go ahead and do that?
Okay, so I have your slide up. I don't know if you saw it. I shared your slide before now. I'll do that again. So
it's pre-recorded. It's pre-recorded. So the audio
oh,
is
it has
there,
an
the slides
audio.
are there. You just need to play it.
Okay, okay, okay.
So if you just go to slide show and start the slideshow, it will play by itself. Hello, everyone.
All right, got it. Okay, so so sorry about that. I actually converted it to PDF because I didn't realize it was a recording. I'm going to share it now, and we would all be able to hear and see a slide. Apologies for that, please. All right. Can we all see? Oh no, this isn't.
Hello, everyone. Good afternoon.
Can we all confirm that?
Why the focus on Parkinson?
Yes, please.
Thank you.
Hello, everyone. Good afternoon. I'd like to start by thanking the Adewunmi Desalu Parkinson Foundation for hosting this webinar in commemoration of the World Parkinson Day 2024. My name is Njide Okubadejo. I'm a professor of neurology from the College of Medicine, University of Lagos. And a fun fact is that the red tulip is used globally to signify Parkinson's disease. Why the focus on Parkinson's? Well, Parkinson's is the 11th highest cause of neurological disability worldwide. And in fact, in 2015, it was described as the fastest growing neurological disorder because of the number of people affected, because of the magnitude of disability that those affected suffered, and because of the number of deaths associated with Parkinson's. And in 2003, recognizing how important the disease was at the time and how important it would become in the future, the WHO issued a global declaration on Parkinson's disease that had the main focus of encouraging world governments and healthcare providers to take strong and decisive action to make Parkinson's disease a public health priority, including improving the treatment, education of healthcare workers, and access to care across the full spectrum of the disease. In terms of the numbers affected, we presume that about 0.3% of the world population has Parkinson's disease. And using those numbers against Africa's population, we estimate that in 2020, about 4 million Africans had Parkinson's. And by 2050, which is just around the corner, about 7.6 million Africans will have Parkinson's. Specifically for Nigeria, based on a similar assumption upon which the Africa figures have been computed, that is a prevalence of 0.3% in the general population, we are currently at a population of about 230 million. So we estimate that about 683,000 people are living with Parkinson in Nigeria. Since our focus this afternoon will be navigating the challenges and opportunities within the Parkinson's healthcare system, I will summarize some of the main challenges and then highlight some opportunities, including those that we and others have taken advantage of. And the challenges are largely applicable to most low middle income countries, but also have to be in the context of the underdevelopment of the neurological health system in Nigeria and elsewhere. So luckily for us, though, the WHO has given impetus to there being a focus on Parkinson's disease by governments by using Parkinson's disease as a tracer condition in measuring the actions and the measurable outcomes of its intersectoral global action plan for neurological diseases. And we're hoping that in the years to come, many governments, including ours and policymakers, will use these actions to improve the landscape for people with Parkinson's disease. So the main challenges are with respect to diagnosis, treatments, social support, policies and legislation, and research. And across board, awareness is an issue. when it comes to recognizing the features of Parkinson's, both for the public and for healthcare professionals. Expertise for diagnosis, access to therapies is a major issue. Access to other services, availability of infrastructure to support the care of people with Parkinson's. Policies specific for people with neurological diseases and Parkinson's are largely lacking. And prioritization of neurological disorders, including Parkinson's disease, is an issue that needs to be addressed. And then, of course, funding for all these activities, but also funding for research has also lagged behind. Now, the person who's primarily affected by all these discussions is the person with Parkinson's disease. And there are some challenges that they are faced with and their carers are faced with. So, for instance, people with Parkinson's disease in Nigeria and elsewhere have a challenge of getting the correct diagnosis and getting it early. Most people with Parkinson's disease will get a diagnosis maybe 24 months after the onset of the recognizable motor features. Getting support for patients and carers is a challenge. Accessing drugs for treatment, both because of availability and affordability, and also likewise accessing multidisciplinary care and specialist physician care are also challenges. Now, another major challenge is the impact of Parkinson's on the well-being and quality of life. So the motor features, the non-motor features impact well-being and quality of life, but there's also the impact of the condition and all that comes with it on their emotional well-being, their mental health, their finances, their social well-being, and their physical well-being as well. So let's start with the challenge regarding the neurological workforce in Africa. In summary, there's a dearth of both physicians and in general and neurological physicians for the treatment of Parkinson's disease. So the global average, for instance, for adult neurologists, neurosurgeons, and child neurologists is about 3.1 of these specialists, 100,000 of the population. For Africa, that figure is 1 per million. And for neurologists specifically, 100,000 of the population, the global average is about 0.43 per 100,000. I think that's about 4.3 per million. For us, it's about 4 per 10 million. So there is a shortage, and all these figures were computed before the JAPA era. Other healthcare workers are also in dire shortage. So the density of physicians, nurses, other healthcare workers for sub-Saharan Africa is about between a quarter and an eighth of what is the global average. And so the shortage is wide-ranging. And again, this illustrates that shortage yet again. So the the Global Burden of Disease study I had mentioned before had a look at what the magnitude of this shortage is. And you can see that sub-Saharan Africa has a shortage of about 1.9 million physicians and about 5.6 million nurses in general. So we can see that it will take quite a lot of concerted effort and a lot of initiative and innovation to be able to bridge that gap. Another gap that exists is availability of therapies for Parkinson's in Africa. And along with colleagues in the Movement Disorder Society Africa section, we have continued to monitor the status of things. And we have found that there is a dearth of therapies for Parkinson's disease, including drug medications, but also including other therapies like surgical therapies, nurse specialists, and so forth. Regarding education is
okay, so sorry everyone. So Prof, I was told that you would like to present your slides. So I'm going to ask you to unmute now so that we can continue from where we stopped. Is that okay, Prof? Let me just ask you to unmute. Sorry, I have to look for you. Okay. You can speak. You can speak now, ma'am. Hello, ma, can you hear me?
Allow me to unmute. Okay, great. I've unmuted. Do you want me to stream from my end, or I should present live from my end?
Okay, so I can also give you co-hosting permission.
Thank you. And we can do that really quickly if you allow me to share my slides.
All right.
Thank you.
Okay, done that now. You can share, ma.
Thank you. Okay, I need to first confirm if you can hear me, and then I'll move ahead very quickly. Can you confirm? I'm sharing the sound. Can you confirm that you can hear?
Yes, I can hear you. I can hear and I can see the screen,
Professor of
ma'am.
Neurology from the College.
So I'll just move ahead.
Yes, yes.
Specifically for Nigeria, based on a similar assumption upon which the Africa figures have been computed, that is a prevalence of 0.3% in the general population. We are currently at a population of about 230 million. So we estimate that about 683,000 people are living with Parkinson in Nigeria. Since our focus this afternoon will be navigating the challenges and opportunities within the Parkinson's healthcare system, I will summarize some of the main challenges and then highlight some opportunities, including those that we and others have taken advantage of. And the challenges are largely applicable to most low middle income countries, but also have to be in the context of the underdevelopment of the neurological health system in Nigeria and elsewhere. So luckily for us, though, the WHO has given impetus to there being a focus on Parkinson's disease by governments by using Parkinson's disease as a tracer condition in measuring the actions and the measurable outcomes of its intersectoral global action plan for neurological diseases. And we're hoping that in the years to come, many governments, including ours and policymakers, will use these actions to improve the landscape for people with Parkinson's disease. So the main challenges are with respect to diagnosis, treatments, social support, policies and legislation, and research. And across board, awareness is an issue when it comes to recognizing the features of Parkinson's, both for the public and for healthcare professionals. Expertise for diagnosis, access to therapies is a major issue. Access to other services, availability of infrastructure to support the care of people with Parkinson's. Policies specific for people with neurological diseases and Parkinson's are largely lacking. And prioritization of neurological disorders, including Parkinson's disease, is an issue that needs to be addressed. And then, of course, funding for all these activities, but also funding for research has also lagged behind. Now, the person who's primarily affected by all these discussions is the person with Parkinson's disease. And there are some challenges that they are faced with and their carers are faced with. So for instance, people with Parkinson's disease in Nigeria and elsewhere have a challenge of getting a correct diagnosis and getting it early. most people with Parkinson's disease will get a diagnosis maybe 24 months after the onset of the recognizable motor features. Getting support for patients and carers is a challenge. Accessing drugs for treatment, both because of availability and affordability, and also likewise accessing multidisciplinary care and specialist physician care are also challenges. Now, another major challenge is the impact of Parkinson's on the well-being and quality of life. So the motor features, the non-motor features impact well-being and quality of life. But there's also the impact of the condition and all that comes with it on their emotional well-being, their mental health, their finances, their social well-being, and their physical well-being as well. So let's start with the challenge regarding the neurological workforce in Africa. In summary, there's a dearth of both physicians and in general, and neurological physicians for the treatment of Parkinson's disease. So the global average, for instance, for adult neurologists, neurosurgeons, and child neurologists is about 3.1 of these specialists per 100,000 of the population. For Africa, that figure is 1 per million. And for neurologists specifically, per 100,000 of the population, the global average is about 0.43 per 100,000. I think that's about 4.3 per million. For us, it's about 4 per 10 million. Other healthcare workers are also in dire shortage. So the density of physicians, nurses, other healthcare workers for sub-Saharan Africa is about between a quarter and an eighth of what is the global average. And again, this illustrates that shortage yet again. So the WHO, the Global Burden of Disease study I had mentioned before had a look at what the magnitude of this shortage is. And we can see that sub-Saharan Africa has a shortage of about 1.9 million physicians and about 5.6 million nurses in general. Another gap that exists is availability of therapies for Parkinson's in Africa. And along with colleagues in the Movement Disorder Society Africa section, we have continued to monitor the status of things. And we have found that there is a dearth of therapies for Parkinson's disease, including drug medications, but also including other therapies like surgical therapies, nurse specialists, and so forth. Again, policies and legislation are important for driving action. And when the WHO in 2017 surveyed its member countries per region to see what the status of policies and legislation for neurological disorders was, more than 3/4 of the African countries indicated that they had no dedicated neurological disorders policy, and only about 7% had a dementia legislation. Regarding financing and social welfare support, the scenario is not much different. Again, based on that 2017 WHO scenario, and I know that not too much has changed since then, none of the African countries surveyed had a separate budget line for neurological disorders, and about maybe 20% had some non-monetary or monetary social support, and then more than 90% of them had no residential care arrangement. Education is key to
No, I'm not sure if it's frozen or it's the internet.
I think it's probably your internet. It's
Okay, can you
frozen.
hear me? Can you hear me though?
Yes, yes, we can hear you.
Yes, we can hear you,
Okay.
ma'am.
Okay, let me try this again. The internet will get you. Okay, can you now see?
Yes, we can see.
Okay, let's see if we can hear as well.
Improving the system of care for people with Africa. And in this survey that I'm sharing here, again, the Movement Disorder Society Africa section members looked at the gaps and prospects of movement disorders education and research in Africa. And largely that had to do with Parkinson's disease education. And we find that only the countries shaded in dark green in that map of Africa had available structured training, meaning that they had movement disorders or Parkinson's education in the undergraduate curriculum and possibly in the postgraduate curriculum. So how do we address this gaps? Well, institutions, professional associations, policymakers are key at the national level, governmental as well as non-governmental, but also at the regional and continental and international level. Industry partners, including research funders and pharmaceutical industry, are important and key to this. And then patient advocates, very important, especially support groups, the media, civil society, interest groups, because that's a really loud voice that can lend itself to getting policymakers to do right. So back to that slide I shared about the challenges that a person with Parkinson's disease personally in sort of in concrete terms will face. There are many things, actions that can be taken by stakeholders to ensure that these are improved. So I'll just give one or two examples. One would be getting a correct diagnosis. So understanding the symptoms of Parkinson's disease by creating public awareness through social media is really important so that people can get to hospital earlier, but also educating healthcare professionals so that they can make a correct and accurate diagnosis early enough is important. Understanding the burden of Parkinson's in Africa is another important concept because we do need this sort of primary level data in order to show what the burden is and to understand and plan our health services to meet this burden. So we're engaged in a study called TRAPCAF. TRAPCAF is Transforming Parkinson's Care in Africa. And one of the components of TRAPCAF is a prevalence study where we're going door to door in the community in Lagos, Mushi, and Surulere local government areas to understand the burden of Parkinson's disease. So we're going, currently our field workers are actually out in the field, started on April the 2nd, and we hope that with this data we'll be able to bridge that gap in knowledge about what the burden is in Nigeria. The TRAPCAF study that I mentioned is really a multidimensional project. We have many partners. It's funded by the UK National Institute of Health and Care Research and is led from the Newcastle University in the UK, led by Professor Richard Walker. And several African countries are involved. And then we also have partners including Parkinson's Africa and the Michael J. Fox Foundation and the Global Parkinson's Project working together with us. And there are many aspects of Parkinson's care in Africa that we're looking at, including understanding the lived experiences of people with Parkinson's, understanding the genetic and environmental risk factors, conducting a clinical trial of a bean called Mucuna prurens that contains levodopa, and community engagement and support and education and awareness, of which Parkinson's Africa is really driving that initiative within the TRAPCAF project. There are other things that we're doing. So other Parkinson's research of particular importance to us is our genetics study, because if we understand the genetics, of Parkinson's in Africa, we'll better understand the underlying mechanisms, and then we can develop more specific treatments or hopefully a cure. So we've been really privileged to be funded by the Global Parkinson's Genetics Program, the Michael J. Fox Foundation for Parkinson Research, and the Aligning Science Across Africa, ASAP. And as God would have it, we made a significant discovery of a major risk factor for Parkinson's disease in Africans. And we're now currently looking at how that can be translated, as they say, from bench to bedside. Key to all these genetic studies is the Nigerian Parkinson's Disease Research Network, which is a network of about 50 neurologists across Nigeria, all members of the Nigerian Society of Neurological Sciences. And these researchers are not only studying various aspects of Parkinson's disease, but they're also specializing in the treatment of and diagnosis of Parkinson's disease. So together, we've been able to study more than 2,000 people with Parkinson's and more than 2,500 healthy controls. And we hope that the information that we gather will help us to change the landscape. Education and training, like I said, is key, and medical schools are credited with laying the undergraduate foundation for Parkinson's education, and then continuing professional education is largely by the efforts of individuals, specialty organizations, support groups. I want to really thank all the organizations that I have put their logos out here: the National Postgraduate Medical College of Nigeria, the Fumi Fashinor Foundation, the Nigerian Society of Neurological Sciences, the African Academy of Neurology, the World Federation of Neurology, TRAPCAF. But most importantly, and I dare say, is the greatest investment in education and training for Parkinson's disease, for physicians, for nurses, for neurologists, for physiotherapists across Africa, and I dare say across the world, has been the investment by the International Parkinson and Movement Disorder Society. And I also want to acknowledge the role that within Nigeria, colleagues at the Lagos University Teaching Hospital and the University of Lagos have played in really driving Parkinson's disease education across Nigeria. That credit really ought to go to them. So the NPDR network I mentioned, we're able to provide access to specialty clinics and services for Parkinson's, and we have the Parkinson Nigeria website where you can find a neurologist just by following the prompts. We need to update the number of the names and the sort of addresses where the neurologists can be found, but that is available online. And in that clinic, as I mentioned, just by establishing that clinic alone and having that focus, we've continued to increase the number of people with Parkinson's disease and movement disorders that we see annually. Oh. Now, addressing medicines care access is also very important. And we, along with others in the Movement Disorder Society, what used to be the Task Force for Africa, were able to identify a need to include more effective formulation of levodopa within the WHO Essential Medicine list. And we're proud to say that with our effort, and certainly the effort of others, I'm sure, the 125 formulation was included in the WHO Essential Medicine list, which is a list that governments in many low, medium income countries rely on for registration and for procurement of levodopa. Regarding access, we do have figures that clearly demonstrate from across the geopolitical zones in Nigeria that overall we have limited medicines availability, plus the medicines are largely unaffordable. We have also engaged in that field for several years now, on the global field, talking about how to make access to medicines a priority issue in Nigeria. The International Parkinson and Movement Disorder Society that I've mentioned several times recently established a committee on equality of access to care, which have been invited as the role of bringing together stakeholders on a global forum to sort of know what's happening, what can be done, with the eventual aim of ensuring that it's not just talk, but that the medicines get to the tables of those with Parkinson's. And we've also been very, very fortunate to have philanthropists donate medicines to our Parkinson's disease clinic in Louth, starting with Teva Canada several years ago, and most recently the Farah Foundation and the Fumi Fashinor Foundation. So stakeholder engagement, like I mentioned earlier, is also very important. Governments and policymakers and interest groups need to continue the conversation and take decisive actions. We need to continue to create public awareness through webinars, press engagement, social media engagement, and community sensitization. And I'm really proud to be associated with Maury and the ADPF and Parkinson's Africa and TRAPCAF, especially for their roles as strategic partners in helping to improve the scenario. And finally, my take home would be, please help spread awareness and information about Parkinson's, support people with Parkinson's and their carers to navigate the system. And if you have the opportunity, speak to a legislator or politician you know about Parkinson's disease and ask them what they are doing. Thank you.
Thank you. Thank you. Please, can we just give a round of applause to Professor Njideka Okubadejo? I would like to see the emoji clap as well. Let's just give it up for her. Thank you so much. Thank you, Ma. That was amazing. So we're going to dive right into Q&A. I know we have some questions, so I'm just going to let us ask our questions. But before we do that, when we sent you an email yesterday and today, we sent you a link to the pre-webinar survey. So if you haven't filled the survey, please, my colleague will drop the link to the survey in the chat box now. Please click on that link and quickly fill the survey for us. We need to get this information. We need to know how you felt or how you were prepared for this webinar. Okay. Without taking too much of our time, we're going to move to the questions. So if you have questions, please can you just type it in the chat box. Professor is here she's here for some minutes to take our questions and answer them. So I'd like to just wait for us to send in our questions. Whatever question you have, please send it in. I'm looking through the chat box now to see if there are any questions yet. Do we have questions? Okay, so while we wait for other questions to come in, so I have one question for Professor, and the question is, can you give some tips to, so I know we have general practitioners here, we have people who work in public health, so can you please just give us some tips on how a person who is not a neurologist or who is in the medical system, in the healthcare sector, and who is like the first line of contact to a person who, to people who are ill, can you give them tips on how to identify, what are the things to look out for before they refer a person to the neurologist? So what are the things to look out for in a person who may present some symptoms of Parkinson's?
Okay, thank you. Brilliant question. I'd like to first of all start by correcting my slide and saying that on that slide about education, certainly the ADPF should have been on that slide. So please forgive me. Regarding the question, so I think the tips I'll give, so I'll say 3 things to look out for plus some. So the top 3 things to look out for in suspecting Parkinson's, the single most important is actually slowness. We know that older people get slow, but this slowness is really when a person is complaining that they're walking slower than people their age, they're not swinging their arms while walking, they find that they have difficulty rising from a low chair, getting in and out of a car, or that they're just generally slowed down in their normal activities, in their dexterity. So that's one. The other one is tremor. So tremor is shaking of the hand, and usually in Parkinson's disease itself, the tremor is usually one-sided. So if you have anyone complaining that one hand is shaking, or one leg sometimes even is shaking, then be on the lookout for that. The third thing that's fairly common is stiffness. So stiffness is a complaint that somebody has rigidity, which is an important feature of Parkinson's will complain of. And that can be joint stiffness. Many of our patients come and they've had shoulder stiffness for a long time, or low back stiffness for a long time. And they may have seen orthopedics, they may have thought it was arthritis or something like that. So look out for those. And then when I say and some, there are some what we call premotor features that are important pointers to Parkinson's. So one of them is people who talk or act out their dreams while they are asleep. And we call that RBD, or REM sleep behavioral disorder. And that's dream enactment behavior. It's also a very sensitive feature that people who are having early motor features that are a bit subtle have that may sort of, but whenever you're in doubt and there's any neurological symptom, please feel free to refer.
Thank you. Thank you so much, Mira. So we have a question here. It says, are there different types and or stages of PD, and what are the tests used to diagnose PD?
Okay, so thank you. Another brilliant question. So let me clarify some terms. Now, we use the term Parkinsonism for a group of symptoms of which slowness is one, tremor, stiffness or rigidity, and then gait problems. When those are there in combination, we say a person has Parkinsonism. Now, Parkinson's disease is the major cause of Parkinsonism, and we have ways of distinguishing other causes of Parkinsonism. Okay, so in that sense, we have different types of Parkinsonism. We also have Parkinsonism that's caused by drugs or toxin exposures. So we say Parkinsonism is a broad umbrella term. And then there's Parkinson's disease, there's atypical Parkinsonisms, and there are secondary causes. Now, in addition to that, within Parkinson's disease itself, there are different sort of types that we put in. Some people with Parkinson have more of tremor, so we say that they are tremor dominant. Some people with Parkinson have more of slowness and rigidity, so we say that they are the postural impairment, gait dysfunction type. And then some are in between. So we say those are indeterminate. But we have ways in which we formally assess to make this distinction. Now, that's different from the stages of the disease, in that Parkinson's is a progressive condition. So usually a person will start, at least from the point of diagnosis with the motor features, they may have early disease that is one-sided, or as it progresses, it becomes both sides affected. As it progresses, the midline becomes affected. And then as it progresses, they may have problems with gait and mobility, sort of independent mobility. So in that sense, we also have stages of Parkinson's. I hope that answers the question.
Okay, thank you. I hope that answers the question for the individual who asked. So we have another question here, and it says, good evening. How do you treat end of dose freezing? That means your medicine wears off before your next dose and the person starts to freeze. Did you get that, ma'am?
Okay. Can you hear me?
We were not hearing you for a bit, but now we can hear you.
Okay, so I think I picked the question from the chat. It says something about end of dose freezing. Is that what we're referring to?
Yes, that's correct.
Okay, all right. So I don't know who asked it. I guess it's someone that uses the medicine. So when people are taking medicine for Parkinson's, especially when they're taking levodopa and so forth, they may find that after a while of taking the medication or after the disease has been there for some time, the medicine that would normally last about, say, 8 hours when you take a dose starts lasting about 6 hours or 5 hours or less. So we call that wearing off. So the name is intuitive. We say the medicine is wearing off, meaning that it's stopping its work before we expect it to stop its work. Now, what then happens when the medicine wears off is that the person sort of reverts to their symptoms when they are not taking medication. So that's one of doing wearing off. Now, one of the things that is part of that is that they find that they freeze. So freezing is a situation where, for instance, passage. So one of the things that you can do if the freezing is related to the wearing off is that you do a medication adjustment so that the person then takes the medicine for shorter durations or when the freezing occurs. There are other things you can do. You can add another medication that can extend the life of the levodopa that you're giving to the person. And you can do it in combinations. Of course, exercise is always a good thing. So there are several things that can be done for end of dose wearing off.
Okay. Okay, thank you so much, Ma. So I'll just start from the previous question. So the person said, Alabi Oshitui said, I asked a question about test used and it wasn't answered. So I think the question was really about what kind of tests do we use to diagnose PD?
So let me answer that question clearly. In 2024, as we are now, the diagnosis of Parkinson's disease is a clinical diagnosis. You don't need a laboratory test to make a diagnosis of Parkinson's disease. A trained clinician makes that diagnosis based on the history, the physical examination, looking out for what we call, for the characteristic features, looking out for what we call red flags or exclusions that indicate another condition. So and this is the situation for the majority of Parkinson's disease worldwide. Now, in a small proportion of patients where the diagnosis is not clear, you're suspecting something else, then you can go further and do some testing, basically to exclude those other conditions. So the brain MRI, what's called the dopamine transporter imaging of the brain, if it's relevant, and so on and so forth. And now we're developing what we call biomarkers, tests of the spinal fluid, tests of the skin, that can be used, but they are still basically testing. So that is how Parkinson's is diagnosed. In life, it's diagnosed based on clinical criteria. And in death, it can be diagnosed by autopsy, but we don't want to diagnose it that late.
Okay, thank you for that. So Chinoye said, please, can you throw more light to on and off phenomenon and then use of Attain in the elderly? Thank you, Prof.
So thank you, Chinoye. I know that the audience is mixed, so I'll keep it really simple. But so let me start with Artane. So Artane is a medicine of the category that we call anticholinergics that's sometimes used for the treatment of tremor specifically. So some people's tremor doesn't completely respond to levodopa, and sometimes we have to give them an anticholinergic to help. Now, the problem with Artane is that in the elderly, typically people above 60, 65, it causes a lot of confusion, cognitive problems. So as much as you can, if you don't have to use it in the elderly, please do not use it at all. And if you're going to use it at all for any reason whatsoever, you must ensure that you warn the patients, the relatives very, very carefully, and you keep it at the minimal dose possible. So that's the guidance for that. She also asks to throw light on on-off phenomenon. So we talked about wearing off. So wearing off is one of what we call fluctuations in how a person responds to levodopa. Another one is this on-off, meaning that wearing off we can predict. Like I said, you know that, okay, rather than 8 hours, medicine lasts 6 hours. On-off is unpredictable. So it's similar, but it's unpredictable in that it can come 1 hour after you've taken your medicine, it can come 2 hours after. So it's an unpredictable switching from being symptomatic to medicine working, and so forth.
Okay, thank you, Ma. So, so sorry, we won't be able to take all questions, but I'll just take one last question before we move on to the next speaker. We don't want to keep us for too long. Omotola Thomas said, is RBD indicative or linked to other symptoms like hallucinations or dementia-related symptoms? And if so, or generally speaking, is there anything that can be done to slow down the onset of dementia hallucinations?
Okay, so thank you, Omotola, and thank you for joining us. That's a fairly complex question. So what I'd like to say is RBD can occur as a standalone, unrelated to anything whatsoever. So for instance, RBD, like I said, dream enactment, people talking and moving in their sleep while dreaming, it can predate Parkinson's by 10 to 20 years when the person has nothing else whatsoever. The hallucinations and dementia that tend to occur in Parkinson's are a bit complex. Sometimes they can even occur in people who have no RBD whatsoever. In terms of addressing them, so they tend to occur later in the course of Parkinson's disease. In terms of addressing them, one needs to be sure that the medications are not contributing to the dementia or the hallucinations. And also one needs to be sure that there's not also like a drug-drug interaction that's promoting the dementia or the hallucination. And if that persists, there's certainly medication that can be given to someone that has Parkinson's who's showing those symptoms. So in terms of slowing dementia and hallucinations, well, what can we do? A healthy lifestyle. Maybe that's what has been shown the most to help with dementia, a healthy brain lifestyle.
Okay, thank you so much. We are so sorry. We would not be able to take all questions. However, we've collated your questions. And if you have further questions, please send them to our email, our programs email, programs@Desalu Parkinson's Foundation.org. We'll drop it in the chat box. We'll collate your questions and send it to Professor. Hopefully, when she has some time, she'll be able to take all the questions and answer them, and we'll send them back to you. Thank you so much. We'd like to say a big thank you to Professor Njideka Okupadijo for taking out time to, okay, so she says she will still be around to answer some questions in the chat. So you can drop your questions and she would answer the ones that she's able to before she leaves. Thank you, Matt. Thank you for having us. Please, can we all just type in thank you, Professor, in the chat box? Thank you so much. We are grateful on behalf of the Adewunmi Desalu Parkinson's Foundation. We appreciate you. Thank you. So, moving on to our next speaker. Okay, moving on quickly. We'd like to introduce our next speaker, who will be taking us on the next topic of today, and is no other person than Dr. Momodu Cham. Dr. Cham is a public health
Hello. I think our network is frozen. Can you hear me? Okay, let me just go ahead while we wait for her to come back. Dr. Momodu Cham is a public health physician, specialist with the Diocesan Health Service in Ghana, with a professional career that spans nearly 2 decades. He has spent all his time helping Ghanaians live healthy lives. For 8 years, he has worked as a medical superintendent of the Richard Lovetti Catholic Hospital, and he has also been a member of the South Togwan District Health Management Team, the Diocesan Health Council, and the Regional Health Management Team. Its focus area includes capacity building in districts, practice, skills, and diagnosis, Parkinson's disease, maternal and child health, clinical governance, community-based care system, including empanelments, then quality improvement, infection prevention and control, and peer review of health system. Without wasting more time, let us just put our hands together. We can just use the icon and welcome Dr. Mamadou. Thank you. Thank you for joining us. Over to you now.
Thank you very much, John, and a very good afternoon from Tema in Ghana to all of you. Thank you for joining from all over the world. I can see people from Nigeria, Ghana, the Gambia, Turkey, Saudi Arabia, all joining us today, and it's wonderful. Thank you to ADPF for the invitation to be a part of this World Parkinson's Disease Day seminar. And thank you, Professor Okubadejo, for that wonderful presentation to get us started. I will be discussing the challenges and opportunities with regards to Parkinson's disease management within our healthcare system in Nigeria, as well as the rest of Africa. And I will be approaching all of this from my background as a public health physician, but who also takes an active part in the management of Parkinson's disease clinically due to the shortage of neurologists within Ghana and specifically the Volta region of Ghana. Next slide, please. John, can we move to the next slide, please? I hope you can hear me. I think I can equally share the slides from my end if you can enable that.
Okay, so sorry, we had a bit of a network glitch. Please, can you all see my screen now?
Yes, we can see your
Can you
screen.
hear me and see my screen?
Yes, thank you.
All right, thank you.
Yes, we can hear you. We can hear your screen. Thank you very much. So, as has already been mentioned, Parkinson's disease is the fastest growing neurological disease in terms of death and disability between 1990 and the year 2016. The prevalence of Parkinson's disease globally has practically doubled over the past 25 years. These facts should put Parkinson's disease in the category of diseases of public health importance. There are other criteria that make us to put it in the category of diseases of public health importance. But herein lies the beginning, the data we need to begin our advocacy for Parkinson's disease. Yes, the figures we have just mentioned represent a challenge, but they are also an opportunity for us to start doing something about Parkinson's disease. Now, you can see from the diagram here that Parkinson's disease is not uncommon in Africa. It is just not commonly looked for in Africa. And that is something which can be translated into an opportunity. If we look for it, we just might find it in the various African countries in which we don't have a lot of data about the prevalence of Parkinson's disease. And it is such data that we can use to speak to policymakers, to politicians, to heads of institutions, and to benevolent organizations to actually help put Parkinson's disease care in their agendas and be able to roll it out for the people who need it in all parts of Africa, including Nigeria. Next slide, please. Professor Okubadejo has mentioned the scarcity of neurologists, and this is a challenge when it comes to managing Parkinson's disease. This morning, as part of the TRAPCAF Parkinson's Africa virtual support group meeting, we had a participant from the Gambia who joined us. And according to him, there is no neurologist in the Gambia. So that means for a population of about 2 million people, there is no neurologist. In high-income countries, you have about 7 neurologists per 100,000 population. The World Health Organization recommends at least 1 neurologist per 100,000 population. But in Africa, specifically Sub-Saharan Africa, we have about 10 times less the recommended number of neurologists per 100,000 population. And this is one of the challenges we have. And we have to create opportunities to be able to mitigate this challenge, both short-term opportunities, short-term trainings, and shifting of tasks to non-neurology physicians and also to other health workers. In Ghana, for example, to mental health nurses, general practitioners who all need to be trained on how to diagnose Parkinson's disease and to initiate management in consultation with neurologists. So this is one key challenge which a lot of organizations are now trying to solve. I'm very happy to hear that Nigeria has 50 neurologists at least, and I think that is wonderful. And we are looking forward to increasing that number through advocacy partnerships and also spreading that influence to other African countries who may not have neurologists as of now. Next slide, please. So human resource to manage Parkinson's disease is one challenge. Another challenge is availability of medicines to manage Parkinson's disease, as has already been highlighted. In most African countries, specifically Sub-Saharan Africa, medicines to manage Parkinson's disease, levodopa to manage Parkinson's disease, is only available in about 40% of hospitals and about half of other primary healthcare settings. So if you picture somebody living in a community far, far away in a rural part of Africa, their ability to get diagnosed, first of all, and then get treatment is further reduced and compounded by this fact that in their primary healthcare setting, only 20% of them might have access to medication, levodopa, to manage Parkinson's disease. So this is the second challenge. And again, it's also an opportunity. And we have already seen from Professor Njideka's presentation that there are a number of organizations working to try and solve this challenge, or at least improve the status quo so that we would have higher availabilities of medicines within hospitals and primary healthcare settings. The challenge is that not everybody can move to the specialist hospitals where we have most of the neurologists working to get diagnosed and get treated. So if we are really talking about improving access to diagnosis for people living in communities, then we have to look at availability of the diagnosis at community level and also availability of the medicines that we have just highlighted here in our community settings and primary healthcare settings moving forward. Next slide, please. We try to address 4 gaps when it comes to Parkinson's disease. We need to address the problem of awareness. A lot of communities are not aware that Parkinson's disease is actually a medical condition. Some think it's just a natural consequence of aging, that when you are aging, at some point you become slower, you develop tremors at rest, and then you develop stiffness. So there are communities where it is just seen as a part of the aging process. So this awareness creation is very important. But before you start creating awareness and diagnosing people with Parkinson's disease, we must have trained health professionals. And more importantly, we must have medicines to be able to treat them. Because raising awareness increasing diagnosis without having medication or trained professionals to manage them might increase the anxiety of people with Parkinson or their communities. So we have to make sure that we continue to train professionals. And I again give credit to the Parkinson's Disease and Movement Disorder Society. They organize training sessions all over Africa. A couple of years, about 10 years ago, we had one in Ghana, which was attended by a lot of people in West Africa, health professionals, and they are about to have another training session in East Africa, in Kenya, to train health professionals in the diagnosis and management of Parkinson's disease. So we are very grateful to the Parkinson's Disease and Movement Disorder Society for these opportunities that keep coming up. So once we are able to raise awareness, have enough medicines, and train professionals to diagnose Parkinson's disease, then we can start an awareness campaign, community by community, region by region, to raise awareness, float case definitions, and be able to diagnose more people with Parkinson's disease and manage them. And of course, with diagnosis also comes opportunities for further research for us to be able to look deeper into the causes and then the factors influencing the occurrence of Parkinson's disease. We are going to have to do all of this through advocacy. And as Professor Okubadejo has mentioned already, the World Health Organization is on board. A lot of organizations, international foundations are on board. The Michael J. Fox Foundation, Parkinson Africa, ADPF, that's organizing this wonderful forum. You have other organizations in Ghana, the Anyidasu Foundation, that are all involved in raising awareness and creating opportunities to close the gaps in Parkinson's disease. But we as advocates, we as health professionals, we as people with Parkinson and their caregivers have a duty to make sure that Parkinson's disease makes it to the agenda of our regional bodies, whether it is the African Union, whether it is ECOWAS, whether it's the East African groupings, and so on. It is our responsibility to keep advocating with our local politicians, presenting at the international conferences, and raising awareness, getting people involved, whether it's in social media or elsewhere. We have a responsibility, given the demonstrated disease burden that Professor Njideka and myself have spoken about so far. It qualifies to make it to these agenda setting tables, and it is our duty to make sure we get it there. Now, at the regional level, national level conferences as well, it is our duty to make sure that the burden of Parkinson's disease and the future implications of our aging populations, the African population is aging at a very high proportionate rate compared to other parts of the world. So we might naturally see an increase in the prevalence of Parkinson's disease in the coming decades. And our stakeholders, our political leaders, and our national organizations need to be made very much aware that this is something we have to start planning for now. And I believe we have the data to start this advocacy. And we can do this at every level of care, whether it's at community level, involving community level leaders, or whether it's at national level or at mid-level. We have the responsibility to keep raising awareness as far as Parkinson's disease care is concerned. Next slide. At national level, in each of our individual countries, let's please go back to the previous slide. At national level, in each of our individual countries, advocacy would be very well advised if it is done after an assessment of the state of care of Parkinson's disease in our various countries. And this can be done using different kinds of data. We can use our service data, for example. We can check from neurologists or specialists or the teaching hospitals. How many cases of Parkinson's disease are they seeing in a month, in a year? And we can use this as an advocacy tool, because in some neurology clinics in Ghana, and I know it wouldn't be very different in Nigeria, Parkinson's disease is probably amongst the top 5 conditions that are seen at neurology clinics. And this can be used as an advocacy tool. And as mentioned earlier as well, we need to find out what the state of our policies are. as far as Parkinson's disease is concerned? Are there policies that help to support people with Parkinson in our various settings, in our various countries? Do we have policies that help to fund medications as far as Parkinson's disease is concerned? Do we even have policies that mandate hospitals to stock medicines for Parkinson's disease at the various levels? Because that can be a barrier. In some health settings, hospitals, district hospitals are not permitted to stock levodopa, which is the medication used to manage Parkinson's disease. So therefore, you can have a country in which the entire district hospital population does not have Parkinson's disease medications because per their policies in that country, they are not supposed to stock those medicines. So that alone is a barrier as far as treatment of Parkinson's disease is concerned. And if we are going to be involved in advocacy, we need to find out what the state of policies is in our various countries and communities so that we can proactively advocate for the change needed for us to improve the management of Parkinson's disease. It would also be very important for us to know what the availability situation is as far as medicines for Parkinson's disease. There might already be research done in your country as far as availability of medicines for Parkinson's disease is concerned, or maybe there isn't. And if there isn't, it's a challenge, but it's also an opportunity for us to be able to generate data as far as what medicines are available for Parkinson's disease. And once we are able to conduct such surveys, we can now use this as an advocacy tool. The last one, of course, is the prevalence studies. Professor Okubadejo mentioned that in Nigeria, in Lagos, a prevalence study has started. In Tanzania, a prevalence study has started. In the next month or two, in Ghana, in the South Tongu district where I work, through the same Transforming Parkinson's Care in Africa project, TRAPCAF, we will be conducting a prevalence study house to house within our district to search for Parkinson's disease and hopefully at the end of it compute a prevalence rate for Parkinson's disease. And this is a very powerful advocacy tool. And we are very grateful to the TRAPCAF project, Professor Richard Walker, Professor Njideka, and the entire TRAPCAF team in the 7 African countries and in Newcastle University for including us in this great initiative that we can use to generate data for advocacy for Parkinson. And this can be replicated in all other countries within the African continent where this is feasible and possible. Once we have data, we have power, we can advocate for a change. Next slide, please. So we've spoken about Parkinson's disease internationally in terms of policies, in terms of gaps, what needs to be done. Now, the most important aspect, as far as I'm concerned, when it comes to Parkinson's disease, has to come with how communities perceive Parkinson's disease, how they receive the messages we bring to them about Parkinson's disease. And one thing we have realized recently is that communities know about Parkinson's disease. Sampling different communities within our setting, we've realized that we're not coming to introduce knowledge about Parkinson's disease. They already have experienced Parkinson's disease. They have very detailed names, local names of Parkinson's disease, and they have perceptions of what causes it and how to kind of manage it. Some of the names, for example, in the Ewe language in Ghana, Parkinson's disease is called Sitido. Sitido translated means the sickness that gives you stiffness. And I think that's a very informative name. And most of the time, we need to start by knowing what our communities already know about Parkinson's disease and what they think causes Parkinson's disease, what treatments they might have or they might have tried that work for Parkinson's disease so that we can equally look into these possibilities. Who knows, maybe they have discovered a naturally occurring source of levodopa, which we can pick up as researchers and care professionals and develop in the future. So our engagement with different communities has to start by asking them what they know about Parkinson's disease and working from there. We might discover a lot. We might need to change their perceptions, but even that changing of perceptions and behaviors will start with an understanding of where they are coming from, and then demonstrating the efficiency of our methods as far as care for Parkinson's disease is concerned. This is very important because we can't have very effective drugs. We can't have very effective non-drug management strategies for Parkinson's disease, but we need acceptance from the communities before we can offer the care we have. And there is there are myths about Parkinson, which we will need to address as we go into communities to try and gain their trust, educate them, and work with them to identify people with Parkinson and then manage them. It's very interesting that you can walk in most rural African communities and ask if there is a person with Parkinson's disease, and the answer will be yes. This happened to me 3 weeks ago. I walked into the community far from my hospital. We were going for a different reason, but when we finished addressing our community activity, we decided to ask, do you have anybody in this community with these symptoms? As Professor Okubadajo mentioned, somebody with stiffness, somebody who has tremors at rest, and then somebody with slow movement. And within less than 5 seconds, the answer was yes, we do. And in about 15 minutes, we were sitting in the house of this person whose diagnosis we confirmed. And then that was the beginning of her journey as far as management of Parkinson's disease is concerned. Next slide, please. So when we get to the various communities that we will be working with or have already started working with as far as Parkinson's disease is concerned, we are interested in finding out certain key features. For example, what is Parkinson's disease called in your local language? And what is said to cause Parkinson's disease in your community? Does this community have any local remedies that can help manage the symptoms of Parkinson's disease? And this is something we have to keep asking so that we can identify all possibilities. And then we have to demonstrate to these communities that the methods and treatments we are bringing to them are effective and that they can indeed rely on us for the management of Parkinson's disease. Next slide, please. Can we have the next slide, please? Yeah, so while we are waiting for the slide to change, I would just like to tell you the story of my hospital, which is a district hospital in the rural part of Ghana, and our journey as to how we became prominent within Ghana as far as Parkinson's disease care is concerned. And this is our case study, and it might work for others, or you might have to use different methods to be able to raise awareness, identify people with Parkinson, and manage them. In 2008, which is over 15 years ago, we circulated a case definition of Parkinson's disease, and it was people with tremors, stiffness, and slow movement. And we had 15 suspected cases reporting to the hospital within a 2-week period. 8 of them were confirmed to be people with Parkinson's. Since then, fast forward to 2018, and we identified between 30 and 50 people with Parkinson in one district hospital within one region of Ghana. In 2018, we started the Mucuna trial. Mucuna is a legume naturally growing in most parts of tropical areas, which has a high levodopa content, and it's being studied currently as a potential future affordable treatment for Parkinson's disease. And 2022, we have now been part of the Transforming Parkinson Care in Africa project, which is allowing us to further explore awareness, diagnosis, treatment, and research gaps in Parkinson's disease. And I think that this program can be replicated in a lot of different health facilities in other parts of Africa. So the advocacy as it stands continues in our hospital, and within our partnerships in Ghana as well. We have continued to do community announcements. We go from community to community, sharing videos. And again, I have to give credit to Natasha Misbah Fothergill for the Shaking Hands with the Devil documentary, and also the Parkinson's Africa and the Anyidasu Foundation in Ghana for one documentary on Parkinson's in Accra and also in Kumasi, which we have been showing to people when we go into our communities that, no, look, we're not coming to introduce something foreign. We're just coming to show you what already exists. And people are identifying a lot with these documentaries and with the message. They have Parkinson's disease in their communities and they are ready to open up and work with us. And we are doing this community by community. And this will be amplified when we start the prevalence study here in Ghana in the next month or two. So these partnerships will lead to research, more community awareness, and also training. We are starting a training network. Like we said, we don't have a lot of neurologists in Ghana. We have less than 20 neurologists in Ghana. We are working with general doctors. We are working with mental health nurses, who are the first point of call as far as Parkinson's disease in communities in Ghana is concerned. And we will continue to do the national as well as international advocacy that we have already started. Next slide. So that's it. This is my last slide. I'd like to acknowledge my team members who are also here with us during this presentation, the Parkinson's team at the Richard Novati Catholic Hospital and the wider diocese, and also the people with Parkinson and their caregivers. They've been wonderful. They've been amazing. They've given us a lot of good advice, and we continue to learn from them and with them in this journey that we are all undertaking. The Grigori Foundation in Italy, Professor Gianni Pezzoli and Roberto Ciglia were the first doctors that we encountered in 2008 when we started our journey on Parkinson's disease. And we started those early days, and we are still collaborating. And of course, all team members within the Transforming Parkinson's Care in Africa network, with whom we are working wonderfully and having such a great time recording improvements in Parkinson's disease. Thank you very much, and we'll pause here for any questions you may have.
Thank you. Thank you. Thank you so much, Dr. Cham. Thank you for breaking it down. You have literally conceptualized the problems and the challenges to accessing Parkinson's care in the grassroots community. So thank you. We appreciate that. We will take questions, but before then, we want to take Clemmie's presentation. So after Clemmie's presentation, then we will take all the questions that you have. So if you have any question, please note it down, take notes, and then we would take all the questions together after. We'll take all the questions together after Clemmie Alvarez Pizzilo's presentation. I would like to introduce her briefly, so just give me a minute to put up a slide. Okay, can we all see my screen now? So our next speaker is Clemmie. Sorry. Okay, so our next speaker is Clemmie. Clemmie is a gerontologist who specializes in improving the quality of life of older adults with neurodegenerative disorders. She develops programs to create supportive environments that allow independent living. She's also a certified specialist in group evidence-based fall prevention classes and a brain health trainer. Clemmie is the director of, excuse me, my screen is obstructing the slide. Okay, so Clemmie is the director of community engagement at the Parkinson's and Movement Disorder Alliance, PMD Alliance, within the organization. Clemmie's focus is to train and support community wellness and support group leaders to promote physical and cognitive functioning, enhance creativity, promote self-management, and encourage socialization connection. Clemmy is the queen of support group. That's how I call her at the center here. Today, Clemmy will be taking us through navigating the healthcare system, again, advocating for optimal Parkinson's care. She's going to bring a perspective on how they've been able to develop programs that create support group and, you know, basically what they do at PMD Alliance to foster support networks for people living with Parkinson's. So I'd like us to please, in the comment section, please just welcome Clemmy Alvarez Pizzillo as she takes our presentation. So I'm going to stop sharing now, and then I'll highlight Clemmy while I put up our slide.
Thank you.
I'm not sure if there's, sorry, I want to see the comment section to see if we're giving Clemmy the warm African welcome, the warm Nigerian welcome. Thank you. Please, let's keep it coming. Thank you. Welcome, Clemmy.
Yes, thank you. And if you allow me, I would like to share my screen myself.
Oh, yes.
Yeah, John had asked me if, you know, I talked to him about doing that. Well, thank you everyone for having me here. I am Clemmy Alvarez Pizzillo. I think I am the only Clemmy in the world, and I am happy to be known as that, even though my name is Clemencia, but that is my nickname. So I would like to share my screen with all of you, if I'm allowed. Yay,
Please
I
go
am.
ahead. Yeah.
Yes. So yeah, you can all see my screen, right? As I was introduced, I am the Director of Community Engagement for PMD Alliance, and today I would like to talk to you a little bit about navigating care and support and advocating for optimal Parkinson's care. A little bit about PMD Alliance that you probably don't know is that we are PMD Alliance for short, and we are an independent national nonprofit dedicated to providing opportunities for people to learn, live more fully, and spark meaningful connections. It's all about connections. Our vision is to have a world where people across the movement disorder, care, and support ecosystem are resilient, fully confident, embrace self-confidence, and are deeply connected within the community. And I would like to take like 10 seconds for you to take a look at our ecosystem and the different networks that we have in this ecosystem. Everything we do centers around strengthening the networks in this ecosystem. We have the therapy network, medical network, community network, family network, and companion network. Each network plays a valuable role in supporting the person with a movement disorder, and we could not do this important work without them. And our goal is support each of these networks. And now I want you to think about your community, your country, your surroundings. What does your ecosystem look like? Does it look like the one on your screen? So let's move on. Whether it's those living with a diagnosis, their care partners, the adult children, support group leaders, or healthcare providers, we meet the needs of those we serve by providing solutions that fundamentally enlighten, inform, and incite positive change. Everything we do is around the ecosystem. And how are we able to do that? Let me see. Yeah, I did not skip. How do we do that? We reach across all communities, all partnerships, especially our sister organizations. And this partnership was showcased at the World Parkinson's Congress in Barcelona with our team. You can see some familiar people that are here in the Zoom call today as well. Tanya, looking great, smiling big. And then the partnership with Africa started when the PD Avengers, the Wellness Committee, reached out to PMD Alliance and asked us to tailor a support group leader reference guide that can be used worldwide. And we were honored to be asked to use our existing support group leader reference reference guide. And of course, you know, some people there in the screen as well. We met 2 times a month for about 6 months to go through every page of our support group leader reference guide and make changes that can be applied to any part of the world. And that is the final product, the global edition of the support group leader guide. And it is a free tool. It's available digitally on our website. And at the bottom of the screen, you have the QR code. You can scan that QR code and have access to it, download it and print it and use it any way you want. We had the big launch of the support group leader reference guide at the WPC in Barcelona. We shared it with everyone. It was the first time that we were able to have it digitally available also on our website for that event. And I want to take you back to that ecosystem. That is one page of the support group leader reference guide that any community can use to tailor that to the resources that are available in that community. And what I want you to think about, that not all these resources are Parkinson's specific. Think outside the box. Who can help you? Who has what? A church, can they provide you a room to hold support group meetings? Senior center may be a place to hold a symposium, a park to do a physical activity. So there are many organizations in the community that can become your partners, and they can become part of your team. This is a sample of an ecosystem in each community. There you go, ADPF holding a support group meeting in their communities. Who is part of that team? Who is your partner? Here is another example of another bigger group, another event. Who helped you put that support group together? Who provided you with the venue? Who was the speaker? Who is that partner that is going to work with you? As part of the support group resources, we offer trainings. We have an online library available to train new leaders, to offer succession planning. We also hold support group leader roundtables. That is a support group for support group leaders. And we also provide a free Zoom link for support group leaders to be able to hold virtual meetings. So, and all these resources are available for free on our website. And you can again scan the QR code that will take you directly to our support group leader training library. If you don't have speakers, but you have topics that are relevant to you, we have our online video library where you can type any topic that you might be interested in, might be dementia or urinary issues, sleep, nutrition, depression, any topic, and you will find different presentations about that topic. That what we do is we watch with our groups and then we have a discussion about that topic. I am a support group leader, and this is a use that we tool when I don't have a speaker. So we are here to support you. We are part of your support, care and support ecosystem. And visit us, pmdalliance.org. We are here to help in any way that we can. And that is my presentation. Short and sweet because I have a support group waiting for me.
Oh wow. Thank you. Please, can we give Clemmy a round of applause? Let's just clap for her. Thank you so much. I'm looking at the chat box, so I'd like to see the clap coming in. Please, let's clap. It's not easy to, just take our time to come and do this. Thank you so much. Thank you, Clemmy. We're grateful. And thank you for taking us through the Parkinson's ecosystem. And this is why we brought you here, because every stakeholder in Parkinson's care has to be represented on a day like this. And we like and love what you do and what you're doing with your team on creating the guide on how to start out to implement, how to continue a support group. We've been a part of your support group lounge and it was amazing, by the way. So we know that this is great work that you do. So thank you everyone. So now we move to Q&A. We move to questions. Would like to take questions and answer. But before then, I'd like us to, let's just hold on. Let me just give us a few minutes. So we'd like to take a poll. I'm going to launch a poll now. I'd like us to please just quickly fill the poll and we would move on to question and answer. So please let me know when you can see it. Can we all see the poll? Okay. Sorry, I didn't realize I was muted. Okay, waiting for our responses. Please let's fill and submit the poll. Thank you. Please, we're waiting for more responses on the poll. Thank you. Please keep it coming. We would just wait for about another minute before we end the poll. Thank you. I'm still at 23%. I would like us to get at least 60% before we end it. So if you haven't filled your poll, please fill it. Or is it my internet? Thank you. Thank you. I can see your responses. Thank you. Please keep it coming. Okay, we're 31% now. We're going to 50% at least. At least. Please let's fill the poll. Thank you. If you have issues with filling the poll, please let me know. And while we continue with that, please, you can start dropping your questions in the chat box. So let's start taking questions now. Please, let's take your questions. If you have any question for Dr. Cham, or you have a question for Dr. Cham and Clemmy. So, Dr. Cham, I'm going to ask you to unmute as well so that you'll be ready to take your questions. So if you have questions for them, please send in your questions. If you have questions about Parkinson's awareness in the community, navigating PD care at grassroots level, and then, you know, support, creating that support system, the ecosystem for Parkinson's, for people with Parkinson's, please send in your questions I will be waiting to take them. And I'm also monitoring the poll. So okay, so I have a question for let me just go on. I have a question for Dr. Cham. So Dr. Cham, so in this part of the world, and very, very similar to Ghana, Parkinson's awareness is like the biggest issue. And as much as we are already located and we have started something and we're doing a great job, you would like to say so, in raising awareness, we also know that we cannot do this on our own. We know that we need foot soldiers. We know that we need people in different communities. And my question is, so what would you say to a general practitioner who is working in what we would call a primary health center or in the local hospital before they get to the teaching hospital and the tertiary hospitals? People who work in the primary health institutions, what would you say to a person who is looking to start, just providing that access, that pathway to diagnosis and to care for a person living with Parkinson's? Where would you tell them to start from? Dr. Cham.
Thank you. Thank you. That's a very good question. And for somebody working in the primary healthcare settings, like you rightly said, what we would call a district hospital, you need partners above you and you need partners in the communities of your catchment area. You need partners above you because as a general practitioner, you need to liaise with the neurologists as far as building your capacity to diagnose and also getting advice on management of Parkinson's disease is concerned. You might be able to diagnose Parkinson's disease. You may not have access to medications. And if you do have access to medications, your patients might have, as you continue to review them, they would come with different problems. They might come with certain complications or side effects that you may not have managed before. They might have fluctuations, and you need to partner with a neurologist for you to be able to train yourself and your staff, build your capacity as you garner experience to manage all of these conditions. But at the same time, you need to identify people with Parkinson, and you cannot do that from the district level. You can only do this by using your community influence. You have to work with grassroots community members. You have to work with grassroots health workers. Even the district hospital workers or primary healthcare settings have lower levels. You have the community health nurses, for example. They live and work in the small communities of about 5,000 people per community. That is where you can get the suspicion of Parkinson's disease to start with. So as a general practitioner, you need to have partners on both sides. You need partners at tertiary or secondary level, that is teaching hospital or regional hospital level. You also need partners at every aspect of community. And I'm not just referring to health workers. You need to partner with local politicians, the local assembly members, the religious leaders. These are the people who can actually suspect and diagnose Parkinson's disease. I mean, I have situations in my hospital where we've raised so much awareness that the carpenter in the hospital went home to his village and identified a suspected case of Parkinson's disease, told the person to come back to the hospital, and guess what? The diagnosis was confirmed. So you need partners for professional management, you need partners for awareness creation, and you also need partners for provision of medication. You have to work with your communities to raise funds or substitute or at least get medications to be available to the people that you will manage.
Okay, thank you. Thank you, Dr. Cham. Okay, so I'll just ask my question and then take other questions. So my question is to Clemmy. So we understand again, we're taking it to Nigeria, right? We understand that we don't have the kind of support group we have here at the center. We do not have it in most places. And the kind of support groups that you have created, that you have helped to build, right? We may not have those kind of systems, those kind of structures around here. So how would you advise a person who has little to no access to the support community, wherever they are? How would you advise them to build and find the kind of support that they need?
Yeah, well, thank you. That is a wonderful question. And the first thing we have to ask ourselves is, what is a support group? What does it look like? And, the support groups that here in the US and in other parts of the world now are the ones we see on TV, right? People sitting around in chairs or crying, but that's not necessarily the case. A support group can be two people walking in a park. Wherever there is connection and helping each other, there is support. So support groups have different shapes, forms, colors. A group of young onset men can be having drinks at a bar. And that is a support group because they are connecting, meeting their needs, sharing their experiences which are very unique to them. So that is where in our ecosystem, we recommend looking at what is available in the community. They may not have the resources that other communities have, but what can you use? Like we said, you may not have a venue that is perfect, but a park may be good enough where we can learn and share and talk about sleep. What are we doing? What natural resources can we use to improve sleep? Something simple like not using electronics 2 hours before going to bed. You don't need an expert in sleep to come tell you that. Those are the kind of things that everyday people are doing. So that is what we motivate. It would be ideal to have a social worker leading a support group leader, but we don't have enough providers. We believe in peer-based support because of those lived experiences, because at the end of the day, when we talk about Parkinson's and talk about experts, who are the experts? I am not. People living with the disease are the experts. And when they share with each other, they learn. So we just want to make sure that we provide that environment where they can come together. So that creates access in the end. So that's how we are able to help get more support groups started in different parts of, the world. And especially when you think about lack of access in rural areas, transportation is an issue. So that is where the virtual world is convenient. So we facilitate that by providing a free Zoom link for those meetings. So I hope that answered that question.
Yes, it does. Thank you so much. Am I on? Sorry. Thank you. Okay, so I would take one of the questions we have here, and it says, I think I saw the question. Does non-motor symptoms aid us in early diagnosis as a way of preventive measures? Okay, I think Dr. Cham has answered that, so there's no need to bring it. Okay, good. What role? So this is, again, I'm sorry, there was a question I spotted. Dr. Cham, thank you for going into the comment section to ask all the questions. Okay.
Yes, I think there was a question about the role of community developers, bringing having community developers, whether this plays a role in Parkinson's disease awareness creation. And I think it's a very big yes, because you are able to raise awareness about Parkinson and actually inform communities about it, the fact that it is a medical condition and there is treatment that can be used to improve the quality of life of people with Parkinson. But it's just that it would be good to strengthen the capacity of health workers to diagnose and manage Parkinson within your locality, ensure that you have management methods, drugs and non-drug for Parkinson's disease, as a complement or alongside awareness creation through the community endeavors, because you wouldn't want to raise awareness and maybe not be able to do much more after that. So community endeavors are actually, we currently do what we call community endeavor and health screening exercises, which are combined. So we go into various communities, we have health talks on Parkinson's disease, we watch the documentaries, and whilst we're doing that, there is a separate team of health professionals who are screening suspected people with Parkinson's disease using the Movement Disorder Society clinical criteria for diagnosing Parkinson's disease. So community endeavors are the way to go in rural communities especially, but I guess also in urban communities as to raising awareness. But this can happen in various settings. It can happen in a hospital. It can happen in a marketplace, in a place of worship, or at the chief's palace, for example. It can happen in very different settings, in very different communities.
Thank you so much for answering that. So we have a question. So we maxed out, and we had audience, people joining on YouTube Live. And we have a question from YouTube, and it says, how do we use Mukuna? This question is for you, Dr. Cham. How do we use Mukuna to manage Parkinson's disease?
Yes, I would say Mukuna is still being studied as a potential alternative for long-term care of PD. So what I would like to do is to just introduce Mukuna. It's still being studied, and probably at the right time, it can be discussed. But I know that Mukuna tablets are already available pharmaceutically in pharmacies around the world. You can order Mukuna on Amazon or eBay or any of the websites. You can actually order Mukuna and have it delivered. I would just say consult your neurologist as far as taking Mukuna is concerned, or consult your clinician, because you are taking, if you are already prescribed Sinemet or Madopa or any other formulation of levodopa, adding Mukuna to it is something that has to be done in consultation with the clinician who is managing you. So I wouldn't recommend Mukuna as a home remedy for Parkinson's disease. I would say that it has to be done in consultation with your specialist. But this is something that scientifically we're still, Mukuna has been prescribed for a host of different conditions, not just Parkinson's disease. It has been prescribed for a lot of other conditions, and that's why it's so widely available in the alternative medicine market. But for Parkinson, we have done a previous clinical trial in Ghana, in Bolivia, in Italy, and we are currently doing further studies. And I think at the appropriate time, we'll be in a position to advise on its long-term use as far as the management of Parkinson's disease is concerned. But it is promising. It is a naturally occurring source of levodopa. It's something that can be grown in your backyard. And there are different names for Mukuna in different cultures across Africa. And we are looking for other possibilities, not just Mukuna. There might be others out there that we are yet to discover. So we just have to keep an open mind and keep looking for sources of levodopa in our various communities.
Okay, thank you. Thank you so much. Thank you. If you have waited from the beginning of the webinar till this time, I'd like you to please just clap for yourself. Clap for yourself and put a clap in the comment section. Thank you. Thank you so much. Thank you for being a part of this webinar. I would hand over to my senior colleague, John Akinola, to give the closing remark and other announcements. Thank you so much. My name is Tuloko Yenuga. I am the programs manager at the Adewunmi Desalu Parkinson's Foundation. It's been a privilege and an honor to have you and to host you through this webinar. So thank you. Please let's welcome John Akinola.
Thank you very much, Tolu. It has been an amazing time, and I know we have learned a lot today. I myself have documented a lot of information that I will go back and review. Thank you so much, Professor Kubadejo. Thank you, Dr. Cham, and thank you, Clemmy. We really appreciate this. On behalf of the Board of Trustees, the Governing Advisory Board, the Executive Team, and the entire ADPF members, I want to say a big thank you to our guests, speakers, and also to everyone that participated in this webinar. We know quite right that you took out chunk out of your time and you stayed with us all through. And we know you have been engaged and you've learned one or two things that you will take back to effect positively. Or after saying that, I would like to say that we have two programs that you must document in your calendar. On the 3rd of May, 2024 is our annual symposium, the second edition. Please document it, mark it in your calendar, and we are going to send messages to notify you of the registration. And on the 29th of June is our Move for PD. For those of you that are in Nigeria or those of you that are in Lagos, we'd like you to join us to raise awareness. It's a 2-kilometer walk, and we want to, see you physically present at the Adewunmi Desalu Parkinson Center, where we move from this place to the stadium close to the center, just to raise awareness and to support people living with Parkinson's and their caregivers. Thank you very much for your time. We appreciate you. Those of you that waited from the beginning till the end, we really appreciate your time. Thank you. And
sorry, before we go, I'd like us to please take a group picture.
Okay,
so this is the time where we all turn on our camera. I'm going to stop sharing now. And then I want us to please turn on our camera. So we have quite a number of people here. So we may need to do 1, 2, 3. So let's give us some time. So please, let's just smile. I'm yet to see some cameras on. Please give us your brightest smile. Are you ready? Okay, it's coming, it's coming. We're still turning it on, so I'm just please don't let your smile wear out. Okay. All right. So I'll take the first batch now. Please keep smiling. Okay, we've done the first one. Okay, so for the next batch, I can't see. Okay, so let's keep smiling. I can't see people on this slide. Please turn on your camera if you're on this second slide. Muturayo, Stella Denloye, Olaoye Olaniyi, Abraham Adeogun, Chere Dakine. Please turn on your camera if you're able to. Let's just take it. Okay, we've done the second one. Last. All right, thank you. Thank you so much.
Thank you so much, Professor Kubadejo.
Professor.
Thank you so much, Dr. Momodu. Clemmy has left. We'll still send our appreciation. So we really, really appreciate the time that you have given us today to educate everybody here about Parkinson's. And we do hope that we can keep the movements going. Okay. Thank you so much.
All right.
Mrs.
Bye.
D, do you want to say something?
Bye.
Oh, she can't.
She can't unmute.
You have to unmute her though.
Oh, she's unmuted now.
Thank you so much, Professor Kubadejo. Getting Professor Kubadejo to do this is like trying to get President Tinubu, because she's really busy teaching all over the world. We are so grateful. We're honored. And we know that we will see more of you because we're going to raise our nuisance value. We just thank you for the knowledge that you imparted, and those numbers. I'm going to take time, and we're hoping that we'll be able to share all those slides if we have your permission to share the slides with the people who were at this meeting, so at least we can digest things better. Cham was so calm and has such an amazing bedside manner, is what we said. I have a side chat going on there, and we all just learned so much. And it's nice to have that practical approach to the stories. And now we've got this plant. Mrs. Mimi Odiachi is a horticulturist, and she has just promised us that she's going to plant mucuna. And she's told me that in Nigeria, it is, for the Yorubas call it wirikbi.
Yeah.
Wirikbi.
Wirikbi.
Yes, that people, the Igbo call it abala.
Let's calm down a bit. We can have a conversation on what to do or not to do with mucuna. As she's planting it, it's called wirikbi. It itches the living daylights out of you, not to replace it.
Said it's already made it to, well, mucuna is called
it's as the name implies.
Teaching provided. I think antihistamines will work. But anyway, since the research is still going on, but as they say, try anything once. And the houses call it Carrara, apparently. Anyway, thank you so much for the little things that are going on. And it's encouraging the rest of us. And as I have said from the beginning of my journey in supporting Parkinson's patients, we don't know where the cure is. And the cure for Parkinson's may be in Africa. So we push and we push until something happens. We want to thank, she's gone, right? Chine is gone?
Yeah.
Yes. Okay. Well, yes. We thank her very much for her time. Thank everybody for being here. Old friends in the room, Tim Hepworth. Tim said we didn't need his camera, and I said we don't have many people from that demographic, so he has to stay on. And thank you for everybody from all over the world. Thank you, ADPF team. Well done, Adewunmi Desalu Parkinson's Foundation team. You put a lot of work into this, and you persisted until you got all the speakers that you wanted. And you already worked at, you also worked at building a good population, a good room. Thank you for the 100 people that were here at some point, and for the ones who have stayed till the very end. And I just thank you all. God bless you. See you soon.
All right. Bye for now. Bye-bye.
Bye.
Bye. Bye. Everyone.
Bye.